Alexis Guild. I'm the Director of Health Policy and Programs with Farmworker Justice. Welcome to our interview series of visiting the state of farm workers in the COVID-19 era. This series is aimed to raise awareness about the impact of COVID on farm worker communities and the work being done to support farm workers and their families. Farm workers have been disproportionately impacted by COVID, largely due to their poor working and living conditions. According to Purdue University's Food and Agricultural Vulnerability Index, close to 500,000 agricultural workers have been diagnosed with the virus. But that is likely an underestimate of COVID's impact on farm worker communities. Since the start of the pandemic, Farmworker Justice has been working with partners across the country to ensure farm workers are able to stay healthy while continuing the essential work of feeding our country. We are here today to discuss the impactful work being done by farm worker serving organizations to respond to the COVID-19 pandemic, empowering farm workers to achieve workplace protections, access to healthcare, and community resources. Today, farm workers are starting to access the COVID-19 vaccine. However, more work needs to be done to ensure that farm workers are able to get vaccinated, to address their living and working conditions, and improve their access to healthcare. Today, we're joined by Tellefson Torres, the Executive Director for the United Farmworkers Foundation. We'll be discussing the work of UFW Foundation to provide farm workers resources to overcome misinformation and to get them access to COVID-19 and the COVID-19 vaccine. Thank you so much, Deanna, for joining us today.
Thank you for having me.
Can you just start off by telling us a little bit about the UFW Foundation and the work that you do?
Sure. So the UFW Foundation is a sister organization of the United Farmworkers Union. A lot of the work that we focus on is to augment the advocacy work at the federal, state, and local levels to ensure that we're improving the lives of farm workers. And we're also providing a lot of critical services on the ground. We're the largest rural California immigration legal service provider. And we have teams of folks that are doing outreach and education right now in multiple states that are focused on emergency relief efforts, vaccination, information, and workers' rights.
Can you tell us a little bit about what you're hearing from farm workers about the situation around COVID right now?
You know, from the beginning of the pandemic, many workers were telling us about some of the challenges on the ground, just not having access to PPE from their employers and having to purchase face masks, hand sanitizer, and other types of protections. And we continue to hear that now. Individuals are still very, very worried about the fact that many people have not yet gotten a vaccine and they have a lot of questions. But I think that there is a lot more hope that's felt compared to what we were hearing in December, for instance. So workers are asking us a lot more questions, a lot of practical questions about access to the vaccine. And so we're seeing that farm workers feel that there is a light at the end of the tunnel, given that they've been risking their lives really from the beginning of the pandemic to continue to feed this country.
And you mentioned you've been hearing questions. Can you share just some of the questions that you've been hearing from farm workers?
Yes, so just very practical questions about the fact that many individuals don't have legal status or health insurance. And so is that a barrier to get the vaccine? So very practical question there. And, you know, we want to make sure that farm workers understand that legal status should not be a barrier, that insurance is not required. And so that is probably one of the questions that we hear the most. What type of ID is going to be needed, or the type of documents that they'll have to show to demonstrate that they're farm workers working in agriculture. So more logistical questions than anything, compared to even 3 months ago, where we were hearing questions about safety and efficacy and how quickly the vaccine was moved to be distributed throughout the country, we're now hearing, how can I get access? Will it be available to me near where I live or work? And so we're hearing more about that. And we're getting a lot of questions about the types of vaccines and how they compare to each other. So I think, like many individuals around the country who have those curiosities, what vaccine should I get? Those are questions that we're getting from workers as well.
And how are you providing information to workers, especially, with all those questions around documentation and residency requirements? Every state is slightly different in terms of who's eligible and what documents you need to provide, if any. So how do you provide that information to workers?
So there's work being done on the ground, that's outreach and education, providing flyers, but also just direct information about where vaccines are available and how to get support with registering for an event. So at the beginning of the pandemic, the UFW Foundation set up a call center where we are providing farm workers with financial assistance during the pandemic. Actually, we've distributed already over $17 million to mainly undocumented farm workers, and food distribution information, etc. So we've been providing that call center information so that farm workers on their own time can call, ask questions, figure out, just getting help with navigating the registration process, which has been quite complex, given that you've had to go on a website usually to be able to register, and often with the limitations of digital literacy, it's been a bit complicated for farm workers to be able to register for an event. So we're providing that information. We also have Radio Campesina Network, which is our sister organization's radio network, the Cesar Chavez Foundation. So we have been providing PSAs that provide information just about the vaccine, for instance, making sure that farm workers understand that when you're getting injected with the vaccine, it's not actually live COVID-19 virus that's being injected into your body. That's something that we were hearing a number of months ago, and a lot of questions about what a vaccine really even is. And so that information that really shows, this vaccine is going to help train your body to combat COVID-19. And so providing information from doctors and others through these PSAs, through regional music, regional Spanish language music, musicians that individuals know, and providing that information. So it's multifaceted, right? Utilizing both traditional social media, but also boots on the ground, really going to places where farm workers are currently congregating. At our food distribution events, being able to provide that information has been critical.
And I know that you've also been involved in some vaccination efforts here in California. Can you just share a little bit about that?
Yes. So after months of advocacy to ensure that farm workers were prioritized for vaccination, we are finally starting to see that there are events that are happening on the ground, and really working both with community health clinics, with county health departments and other vaccinators to ensure that there are mobile vaccine events that are being set up that are targeting farm workers, so that we can make it as easy as possible for farm workers to engage, to be able to have spaces for walk-ins, for instance, where you don't need prior registration and you can do on-site registration. So it's really trying to reduce those barriers in a lot of the agricultural counties, which are really the largest agricultural counties in the country, in the Central Valley and the Central Coast of California, to ensure that we're doing as many events as possible during times when farm workers are available, knowing that many are working currently. And so ensuring that we're doing Saturdays and Sundays and evening hours and taking all of those things into consideration. And I must say, like, we did 1,000 vaccines just this weekend in Delano, which was our historic site. And it was super satisfying to just be able to talk to workers beforehand, and they're like kind of anxious, and yes, you know, they're excited as well because they know that they're going to get this protection. So I think it's finally coming to fruition, but we still feel we're not moving fast enough. There's just so much to be done because California is not the only state where farm workers are located, and we're still waiting for Washington to set up the vaccination. Farm workers, we're still waiting. Georgia has decided they're going to be asking for Social Security numbers. It's ludicrous that anyone would have to show a Social Security number, knowing that farm workers are providing the food on the table for all the public officials who are making those seriously, I would say, bad decisions.
So in states like Washington, Oregon, Georgia, Florida, states where there are a number of farm workers but are not yet being vaccinated at this moment, what are some strategies or challenges that you feel you can share from your experience that others may find helpful as they start to bring vaccines to farm workers?
Yeah, I think, we're seeing that Washington is going to start potentially next week to allow farm workers to get vaccinated. With some of the changes at the federal level of also prioritizing those who are 65 and over, and at the state level, also making decisions about who should be getting vaccinated. What we've really been advocating for is to ensure that those who are most vulnerable, those who are out getting exposed, farm workers are traveling together, oftentimes individuals who are not in the same household are in the same vehicles traveling long distances, they're working together, and then at home sometimes there are different families that are living together in the same household. So it's really, from a public policy perspective and just from a public health perspective, ensuring that farm workers are getting access to the vaccine starting as soon as possible now, yesterday, is really important. Word of mouth in the farm worker community is the best way to communicate with farm workers. So the more farm workers that you start vaccinating, the more farm workers that are going to be talking to other farm workers about their experience, and hopefully it's going to be a positive one. And so the sooner that we start vaccinating, the better. Farm workers are moving from location to location, from county to county, from state to state. And earlier on in the year is the best time, at least here in California, and also, in other states. And so it's important to look at the various, when you're looking at vulnerability indices, to make sure that you're taking into account those individuals that are from the hardest hit communities, the Latino community. Farm workers are almost all farm workers are Latino. A large portion of farm workers are mainly immigrant, mainly uninsured, mainly undocumented. So we really need to take a look at that data that demonstrates that public health departments need to prioritize now.
Absolutely. And I think, in addition to prioritization and the work that you've done here in California, I think really shows that it's important to partner with community-based organizations, with migrant health centers, with community-based organizations, with others who work with farm worker communities in order to ensure that farm workers are able to access the vaccine and are comfortable accessing the vaccine. So I think that's a crucial effort from UFW Foundation and others in order to really ensure that farm workers are able to access the vaccine.
Yes, absolutely. And it's important to to be able to work together, in particular with community health clinics, just asking many of the community health clinics who had not, they still had a lot of capacity left to be able to administer more vaccines. And so looking at how a larger vaccine allocation can go towards vaccinating farm workers is critical right now because of the level of vulnerability, and knowing that most community health clinics are the ones who've been working historically with farm workers, who have been in rural areas where other service providers are not located. And so it's really looking at what that vaccine allocation and distribution process really looks like, and the strategies that are being employed to be able to reach farm workers. So vaccinators who are willing to do mobile vaccination, let's staff them up. Let's give them the resource allocations that are necessary, not just vaccine allocation, but the types of resources to scale, to expand, to go beyond what their current capacity may be, so that we can reach the most vulnerable as soon as possible.
Absolutely. And I also think, partnering with employers is also extremely important, because they also, can provide that access, on site in the housing as well. So it really takes a whole community, I think, to be able to vaccinate farm workers.
Yeah, we just had two 500 vaccine events at Monterey Mushrooms in Morgan Hill, which is in southern Santa Clara County. And they provided the space. They were so wonderful. So the Monterey Mushrooms Farm is a union farm under collective bargaining contract with the United Farmworkers. So it was really wonderful to be able to work together, the community-based organization, the union, and the county health department, along with an employer, to have a holistic way to approach the work, that we're able to provide the education that farm workers need, that we were able to provide some food that they could take home after getting vaccinated, and some wraparound services and information regarding workers' rights that they could contact us with. And so we opened up the event to other farm workers in the region that were able to attend. So, that definitely is a model to be able to follow. I do think it's important to emphasize that farm workers need to be able to receive the type of education about the vaccine beforehand. I directly spoke to a farm worker who canceled an event with us because their employer, the foreman, told them the day of that they were getting a vaccine, and they weren't provided any information, etc. And so we want to make sure that we have a holistic process to ensure that farm workers have the information that they need, get their questions answered, I should say, and feel ready to get the vaccine.
So if people want to get in touch with UFW Foundation and get access to the resources and all the great information that you create and provide, how can they get in touch with you?
Well, we have our call center that's set up. So if you have a family member who's a farm worker or someone that you know, you can call our number at 877-881-8281. I'm thinking in Spanish here because I have it memorized in Spanish. And in addition, for farm workers who have cell phones, they can text us the word essential, and in Spanish, esencial, at 877-877. That's how we've been communicating with many farm workers and providing them information that way. And you can also go to ufwfoundation.org.
Great. Well, thank you so much, Diana, for joining us today. And thank you for all of the work that you do and that UFW Foundation does for the farm workers here in California and across the country.
Thank you so much, Alexis. Appreciate you having me on.
Thank you. And thank you to all of those at home watching our program, revisiting the state of farm workers in the COVID-19 era. Farmworker Justice is a nonprofit national advocacy organization that works at the federal, state, and local level to empower farm workers to improve their immigration status, living and working conditions, occupational safety and health, and access to healthcare. Our work is made possible with the help of our generous supporters. So please visit us at farmworkerjustice.org to become a supporter today and to stay up to date with our COVID activities as well as our ongoing priorities. You can rewatch this episode and the rest of our series, as well as the interviews from last year's series on the state of farm workers in the COVID-19 era on our website, as well as on our Farmworker Justice YouTube channel. You can get connected with us on social media by following us on Facebook, Instagram, and LinkedIn at Farmworker Justice, and on Twitter at FarmWRKR Justice.